you join us here today at the Orwell Hotel. It's Tuesday the 8th of January, and we have, I believe, the first event of its kind, which is a Health and Wellbeing Day. We have somewhere around 35, 40 different groups, some of them across the whole of the county, some of them local to Felixstowe, and we have with us Councillor Noble.
Hello.
How are you doing?
Fine.
Happy New Year.
And to you.
And all that
Nice
jazz. Now, this is a county council initiative, is it? With others, or it's totally your initiative?
Well, it's partly a county council initiative, but it's also about the community coming together, and I think that's what we're seeing here today. You've got pan-Suffolk organisations from Health Watch, and then you've got things which are very, very local to Felixstowe, such as Inspire, the listening service. So you've got a whole range of organisations here. So the county council's part of that, but it's about the community as well.
Right. So these are the bodies that we have, which is what? It's a packed room. We've come out here to get a bit of peace and quiet. So
Indeed,
we're not
lots and lots of people talking about the things that are going on.
Now, we're in a situation now that the Suffolk County Council becomes responsibility for public health.
Yes, as of April, we have statutory responsibility for public health.
Right. So your relationship with the PCT over the last 10 years, when they've been responsible for it, has obviously been interconnected, intermeshed.
Well, I think what's actually happening across all the aspects of public services, I think the notion of silos where the PCT existed, the public health existed, the county council existed, the district council existed, I think that's starting to go. And I think also it's about how you actually work with communities. It's very much more about how people live their lives. I don't think people actually live their lives by going, I go to that silo, then this silo. Actually, people just live their lives and they interact with all these organisations. And I think we have to change so that we behave in a different way as well.
Right. I mean, what we're looking for, I think, on behalf of Felixstowe TV and the community is what services are available to assist people to be well, be better, get support if they've got a particular condition. I notice we've got the Alzheimer's Society here.
Yeah.
They have a local meeting here in Felixstowe, which we're more than happy to give prominence to, because we do have a problem with information flowing out, don't we? And we have this wonderful term, the hard to reach group.
We do.
And what we will find here today, I'm sure, is we'll have a lot of worried well, and we always do, but we won't have those that we'd like to try to get to. On that basis, I don't know, at some point I can have a word with Councillor with regards to how the county is looking to try to improve the health outcomes for younger people, particularly in the schooling system, because I find it amazing that they start at 5, and by the time they get to 11, 100% increase of those who are less fit, and when they came, which seems to be a strange. Well, we're not encouraging our kids to get out there and do things.
Graham's your man to talk about.
Well, I was going to come on
That's
that.
all.
But you're responsible for, what is your portfolio?
Well, I'm Cabinet Member for Health and Adult Care, so that encompasses all aspects of public health.
Keep you awake.
It certainly is a busy role. So,
it's going to, and will become busier, obviously.
Oh, absolutely. And what today is about how we actually show communities what is going on in their own community.
Yes.
And equally showing some of those community groups what else is going on in the community. And really the role of the county council is how do we connect all this? How do we actually make this accessible to people so those hard to reach groups can actually access some of these things? Because when you actually look at what is going on in terms of things like Inspire is a really good example. A really simple listening service.
Yes.
But that can actually head people off to go into far more expensive services with mental health, with the doctors, and it's really about low-level support for people so that they understand what is available in their community rather than simply going to the doctors or simply coming to social services.
Oh yes, so parallel features.
And actually, things that work a lot better for them.
Well, I noticed you've got, there's representatives from the library here today.
Yes, absolutely.
And that used to be a very good source of community stuff, and hopefully that will grow and improve.
Well, certainly one of the
forward.
things we did when we set up the Providence Society that now runs the library service on behalf of Suffolk, it was about talking to them about this real outreach. Here is a community hub. How do we really work that as part of a community? So beyond the idea of actually just lending books, how it integrates and becomes a real part of the community so people can go there, it's a resource, it's a place they can understand what's going on.
So it would be a practical meeting point for, say, support groups for stroke or cancer or Alzheimer's, because one of the difficulties we always have is small groups affording fees to higher places to actually support each other. So that's something you could look at.
Well, a really informal way of going out. There's a cafe here in Felixstowe. You can go and get yourself a decent cup of coffee. You know, it's a really great informal place to meet. And in my own village where I live, I often meet people in the libraries and have a conversation about things that are going on in our village.
Well, thank you very much for that, and compliments on getting such a wide-ranging bit. We won't probably have more time, we'd love to have lots of time and do every stall, but we'll probably concentrate on the ones that are of specific interest to Felixstowe Peninsula. But your caravan,
The coffee caravan, yeah.
will you be taking that down to, say, Langer Road, the other parts of our town, at some point in the future?
Well,
Because
the coffee caravan
that's
is
where the information needs to go into.
Well, the Coffee Caravan is a separate project. It's its own
Yeah.
charity. We are one of a number of organisations that help fund it, and we ask it to go into communities, to go to villages, to go to hard-to-reach places, and literally set up shop and offer people a cup of coffee, sit down and talk to people about
And the
their needs,
information.
and the information then flows. In the summer, when it's not raining, they have a whole rack of leaflets, and Gary and the others that are part of that project, they can sit and talk to people and say, well, have you thought about this, and have you thought about that?
Well,
That's a
we would
really
certainly
powerful
welcome
thing.
it. We would certainly be more than happy to give where we go in, because it needs a fair bit of early advertising for people to get to it.
Well, they have their own
Probably
website, and it's really about but that being out there so people can access that, and the leaflets going into the library, and the leaflets going to other organisations.
But
But it's
I-
really that interconnectivity.
With the
which
greatest
is really
respect,
key.
I think we need to look at those who are website users and in the analogue community,
Absolutely,
of which we have a lot in Felixstowe.
Well, that's why there's a
we
lot
need-
of leaflets.
We need to dual road.
Absolutely,
don't we?
absolutely.
So if I could have a quick word
I'd
with...
just like to
with
follow up
Brian.
on what Colin has just said. I think
Yeah.
it's a real issue in this town. Now we have a predominance of people actually over the age of 50 in this town.
We have.
That is why it's so important we keep drip feeding this information by having this sort of major event, but also in stuff that we put out through like the local town council newsletter, things like that, telling people where these things are and where to get help.
It's the help.
Because
It's so
there are so many people living by themselves in the town. And you know, they'll tell you, well, I've got a daughter in Europe and a son in Epsom or something like that. And that's fine when you've got like the roof's just fallen in, or you've got a major plumbing leak or something
Yes.
like that.
But
actually,
day-to-day getting
day-to-day
better.
stuff of stuff out there in the gardens growing up and it's getting weedy. You've got a light that doesn't work anymore.
Maintaining the
And
property
it's-
becomes a
You
nightmare.
think, who am I going to call in? Who's going to rip me off? Well, here you've got a source of information for all those things.
Yes.
And that's why we've got to keep drip feeding these good organisations out that give free and impartial advice and support to people.
So to that
And
end, the
that's-
district council is integrating with the county.
Well, yeah, we've got district council
Because-
here today
yeah.
on benefits. front
Because we
ones
did
and
sponsor a
too.
repair service, didn't we?
Well, that's
And that was
that's
trusted
today.
and it was
Yeah.
sensibly priced.
But
Well, I think that's a very valid point, and I
we just
think
keep doing that.
Yeah.
As both sort of councillors and you know, through all the organisations that are here, just keep on presenting the information to people because they won't be sitting at home looking for it.
No.
You know, you're not saying, can I look up in this book or this newspaper to find this help?
that's assuming they buy a newspaper now. And that's one of the,
Well,
we're
that's-
noticing, aren't we, the amount of folk who are buying it and the way they get their information. So, and we do have both
Googling
ends,
the
but-
stuff either. Well, I feel a bit miserable today. Let's
Yeah.
Google say, I feel miserable. You don't do that stuff, you know. That's why we've got to keep presenting the information in ways that people understand and feel that they can connect with.
Right. Well, we're hoping that we'll be able to get to peninsula-specific support groups, which we hope. You know, that we need a stroke, we need a counselling. Now, the specific bit that I started young about was, what are we going to do to encourage our younger people, you know, using the Olympic legacy, all of these things, how can we actually encourage them to spend more time either eating perhaps better, but exercising more, being fitter? I mean, is it a square that can't be square?
Well, I mean, I think in terms of sort of enforced behaviour, I think they're on a complete lose.
Well, you won't go.
But, you know, like the Wellbeing part of the organisation, Public Health Service is making it very, very clear the situation that we've got, that children are subject to the pressures of obesity, because like, there's a lot of stuff out there
Yes.
which you could eat, which is not particularly good for you, particularly if taken in large quantities. And we, again, have to keep drip feeding that message. Now, in the primary schools here, we're very lucky. because most of them are quite engaged in a healthy eating scenario. And all the kids want to do it. I mean, the most popular day in school dinners is a Friday. And guess what happens on Friday? You have chips.
Yes,
You know. So it is a question really of work is starting in children's centres. There's quite a lot of focus there on cooking your own food, growing your own food, helping parents at that stage to sort of get engaged with that agenda. But yeah, you know, as schools become further and further separated from local authorities, and that is happening, you know, you're just going to keep on drip feeding that message through the public health service to make sure that it's being reinforced right through school life, because you know, it's very easy to sort of say, well,
I mean, I noticed we've got a cycling presence here, but we don't have the Felixstowe Sports Council, which actually is a mouthpiece for, because we have a huge number of sports available. But what we don't seem to be able to do is to get out there and make people aware of just how much there is.
We've got a cycle highway map now for this town as well.
Yeah.
We should be giving that more out.
And we should be doing summer sport and whatever. But does the county have any view on how it can capitalise and make use of the Olympic engagement, or will that just the legacy diminish?
Well, I think there's two things. First of all, we've been very, very focused on the volunteer aspect of it. So the games methods. And we've got a voluntary organisation set up where people can register. They can say that they want to volunteer once a month or once a year or however often. So people can get involved in volunteering. So that's one aspect of it. I think then it's really about the legacy, particularly for younger people. They look up to some of the sports stars who've done well in the Olympics.
Well, they try it, don't they?
That's
and
right.
they need to be able to try those
and
events.
I think for a lot of
but then
children,
it's consistency, isn't it?
You know how it is, Colin. After tennis fortnight,
Yes.
what happens?
For a
You can't
fortnight,
move
yeah,
on the
move.
Felixstowe tennis court, and all the tennis courts around the place are booked up. And like, I think the Olympics will start to fade as a memory, but we have to keep on drip feeding that stuff. And actually, for people like Felixstowe TV, to concentrate on the offer that they've got down there.
Well, we do.
We're having a cycle festival, I think, in the summer this year. You know, we need to get that out there.
Well, Felixstowe
Couple of
Radio
years'
Island.
time, you will be on everybody's personal mobile device. It won't be a question of receiving it with an air. I think, will it?
No,
we saw
well,
it with
those things
cycling
are moving
as well.
forward.
We saw it with the Tour of Britain. We were lucky enough to
Oh,
grab
yes.
and get
Yeah.
the start of
Yeah.
the Tour of Britain, and then suddenly afterwards there was an awful lot more people cycling, and particularly around children. It's trying all the different activities and finding the one they really like, and then making sure that our sports facilities, our sports clubs and everything else are there, open and accessible, so that they can get involved and find that sport. Because once you get a child hooked on a sport, then you address all those issues.
And they bring mum and dad with them.
Sorry,
I'll
John.
put two pens
Yes.
in here. There are so
John
many
Goodwin.
sporting facilities in Felixstowe: football, basketball, you name it, anything.
Hockey,
from netball,
rugby, the whole lot.
there's
We have a
everything
real.
here.
We're very enriched with sport.
You could really do a bit of an article on each of
Oh, well,
these
we will.
things, because
Yeah,
there's
we will.
so much there, and it needs to
And
be
we're
used.
gonna-
The Walton and Felixstowe Football Club, they've got girls teams, 2 or 3 girls teams, they've got youth teams, they've got children's teams. There's so much there.
Red Devils?
Red Devils,
Yeah.
Trimley, yeah. You just cannot get that good message out.
But we will.
That's something
But we'll try to
really,
get that.
really.
I mean, we have been doing it on Felixstowe Radio for some time, but we do need to move to.
Just on
covering
another point you mentioned, you said about groups needing rooms free of charge.
Yes, that's what we need.
Fire station, community room, free of charge.
Is it? Well, that's a very good message. So, can I thank you all, A, for the scheme. I think it's brilliant, and hopefully we'll get some more. And anybody who comes to us that feels they could have made a contribution, then we'll let's pass it on to you for the next one.
Well,
So thank you very
lovely.
much
Nice to
for
see you.
arranging it. Thank you very much, John.
On with an upward thing. I
Thank
mean,
you,
if we've
Brian.
got 80 people next year, that would be fantastic.
Absolutely.
wouldn't it? You know, that would be-
Okay,
that's
thank you
the
very
objective.
much indeed.